is hindering it. In some countries, it's regulation actually that prevents, say, pension funds from investing in capital market. And you cannot develop the capital market if you don't have your own pension funds able to invest in it. So, doing more of that diagnosis would really help us. And then for our, financial institutions to help and invest in the capital market developments. I wanted to mention something that was a bit, perhaps I hinted to it, but I didn't explicitly elaborate on it in the spring meeting, which is the issue of how you're treated. I am not sure if you've looked at the new guidance note on arrears, lending into arrears by the IMF. So basically, now it's specifically mentioned. Before it was by discretion, more or less. They decide who they're gonna treat how. Now the criteria is it need to have 50% or more of the shareholdings of the IMF, which basically means, the quota distribution. It means that you need to have certain countries for it, of whether, US or Europe and the major shareholders to actually qualify to be treated as one, which is very interesting, So this is the background, and this is one of the things that we need to look into, what it means, does it make sense, what we need to do. Another thing that perhaps I haven't mentioned before, and we've been helping in, and I believe it's a solution, the pooled procurement for pharmaceutical, the Pan-African one that was done, so that it helped us reduce the cost of buying the medicines. It started in COVID, and now we've helped set it up, and now it's the Africa Center of Disease Control that's taking it over. The whole idea is that we get these medicines cheaper because we have a bigger negotiating power, but more importantly, it's for also our pharmaceutical sector and companies, because actually, in many times, they're able to produce the same medicines, but at lower cost, especially like the generic version. So we need to invest, we need to be the change we want to see. So I think it's one of these areas that need to be done. And another, just one, I'm glad to hear from Masoud that, there is financing for health, because my experience, and let me quote the two examples of going to board with financing of health. There was one at EBRD where it was turned down because it's private sector and major shareholders believe it should be done only by the government. And